Sometimes known as the deep six, these six small muscles are located deep to the gluteus maximus and create lateral rotation of the hip, all attached to aspects of the greater trochanter and fan medially to attach to the sacrum and pelvis. All of the lateral rotators are deep to the large sciatic nerve, except for the piriformis. The piriformis lies superficial to the sciatic nerve and, if overcontracted, can compress it. Nevertheless, the lateral rotators are accessible as a group, with the piriformis and quadratus femoris being the most discernible.
So we'll focus on two of the lateral rotators of the hip. First, the piriformis. Let's just superimpose the muscle. There it is. We can see it running diagonally across the buttock from the sacrum to the greater trochanter, deep to that gluteus maximus. We kind of have a sense, of course, of where this muscle is, but there's three landmarks that will really help us isolate it. Those are going to be the PSIS here, the coccyx, and the greater trochanter. And you can see how my three fingers form a T, and across the base of that T will be the piriformis. So let's isolate those landmarks. Here's going to be that dimple on the low back, which is where the PSIS, that posterior superior iliac spine, is. And if you get a little lost, you can always find the iliac crest and find it there. And then from the PSIS, I can walk along the edge of the sacrum all the way down to the coccyx. But now let's stop for a second, because chances are you've never palpated your own coccyx, let alone your partner's. So let's take a moment to do that. If you stand on up, you can find the surface of your sacrum just here in between your buttocks. And then if you follow it inferiorly, it ends at the coccyx. And the coccyx is pretty much in the gluteal cleft, just at the very top. The gluteal cleft being, if you will, the crack between the cheeks. And that's at the very bottom of the vertebral column where the coccyx is going to be located. Okay? So how we can find that on our partner is I'm going to find the edge of the sacrum there, sort of pressing my fingers right into the edge of it. And then I'm just going to work through the sheet and find the very bottom of the vertebral column there. And that's going to be the location of the coccyx. So we've got the coccyx and the PSIS. And then the third landmark is that greater trochanter. It's that superficial point of bone here on the outside of the hip. If I ever get really confused, I can just rotate the thigh a little bit and move the hip, and I can feel it pass underneath my fingers. So now we've found our T. And right along that base is going to be the piriformis. So I'm going to just set my fingers just along that line and work them slowly through the adipose tissue of the buttock and the thick belly of the gluteus maximus. And there we can really feel that sort of 1 or 2 finger wide belly of the piriformis. And if I ask my partner to just try to laterally rotate his hip a little bit against my resistance, so he's going to try to go that way, and I'm going to give him some resistance. Go ahead. There we go. Underneath my finger, I feel a very solid contraction of this muscle. And go ahead and relax, and it softens up as he relaxes. And I can follow it medially as it passes underneath the edge of the sacrum, and then I can follow it laterally as it heads out toward the greater trochanter, becoming thinner along its way. Now, let's just recognize that deep to the piriformis is the sciatic nerve, and there we can see that. But if I'm using a nice, broad finger pads, and I'm not pressing too deep, I'm going to be just fine. So that's one lateral rotator, the piriformis. The second is going to be the quadratus femoris. And there you can see it there running from that ischial tuberosity over toward the greater trochanter. So let's just locate those landmarks again. I'm going to find my partner's ischial tuberosity right here at the sort of bottom of the buttock and just pressing in. It's that sits bone right at the base of the pelvis. And then I'm going to walk over and find that posterior portion of the shaft of the femur right there, and that is where the quadratus will be attaching. So I'll just set my fingers up underneath the gluteus maximus, and feel for the quadratus femoris spanning between these landmarks. And again, I'm going to ask my partner to go ahead and laterally flex a little bit against my resistance. Great. And just a little contraction, a little effort forms a nice solid contraction of that muscle right there. Go ahead and relax. And as he relaxes, that muscle really softens. I can even roll my fingers across the quadratus femoris fibers like so. Great. So we've got two of the lateral rotators right there. And to shorten the entire group of lateral rotators, I can laterally rotate the hip, and to lengthen them, I can medially rotate at the hip. So shortening the lateral rotators and lengthening the lateral rotators.